part 4 of how I got Baker acted last night unjustly by my drunk mother. So I am sitting there, and there's this girl in the ward, and she starts, so I'm in like this room, right, and there's windows that you can like see through, so you can see people like sitting outside. Like this girl was like sitting outside her room who was detained for the same thing, and you could tell she was like schizophrenic. She was hearing voices, she was whispering to herself, she was pacing, you know, those types of things, or maybe, you know, under the influence of drugs. And so she starts like, so my door is closed, but there's like a window so I could like see the nurses station, and then there's like windows over here too where you can like see some of the patients, but you can't like see them sitting. It's only if they stand up you can see them. It's pretty high up. And she starts like peeking into my room and like looking at me, and she's like whispering and all this stuff, and she's like looking, and like I'm like, is she gonna come in here right now? I'm like trying to hurt. Like I started to like freak out. I was like, is she gonna try to hurt me right now? Because the nurses, they're like in a different like locked section behind like bulletproof glass that they have to like, you know, pin in and out of for the med room and their nurses station, obviously to keep them safe. But they leave the patients, you do have a door between them, but it doesn't lock. You can't lock it. And they just like leave all the patients together. So I was like literally praying. I'm like, dear Lord, please just like protect me. I like knew I was protected though going into it, but I was still like freaked out. And so they came, and, you know, I refused the blood test, but I did submit to the urine. So I was like, I'm obviously compliant. I just have my reasoning for why I don't want to get blood tested specifically. And the reason why they wanted to do the blood test was to see if I had alcohol in my system, even though they could tell I was not fucking inebriated. I didn't even have, like, because of, like, my demeanor and stuff. So this PA comes in, and she's like asking me questions. I'm telling her I'm a nurse, like this stuff. And she goes, okay, well, obviously you're a smart woman, right? And I'm like, yep, I am. And she's like, well, you know, this is going to go one of two ways. I have to get that blood specimen from you. The doctor will not medically clear you if I don't have that blood specimen. And I was like, I'm a hard stick. I am dehydrated. I could feel I was dehydrated. I know this is going to go not well for me. And so please no. Please God, no. I will do anything but get a fucking blood test. I will do anything. The thing is, this hospital has a Doppler system, which is like the thing where you use the ultrasound, but it's in the emergency room. So what they could really go do is go get the fucking Doppler and come fucking do it. But you think they do that? Absolutely not. So the lady's like, well, this is going to go one of two ways. She's like, we can do this the easy way, or we can do this the hard way. I either am going to sedate you, or you're going to give me a blood sample. And I was like, holy shit. What the fuck have I got what the fuck did my mother do to me? So I'm like, fine, I'll fucking do the blood sample. And honestly, I realized after this, the sedation would have been the easy way for me in particular. So, you know, there's 3 nurses on board, and they come, and they try to start sticking me. So they go on my arm, nothing. I'm like, okay, I'm a butterfly needle. They usually have to go through my hand. I have to go to a special phlebotomist, literally, to get my blood drawn. Nobody can fucking stick me. I have rolling veins. And I've just always had a hard time with this. And also, I have an extreme intolerance to physical pain. So I already know myself. So once they start sticking me, the asthma starts to get worse. Because obviously, I'm starting to get more stressed out. Because they're not fucking getting it. So the girl gets it. So they start in my arm, can't get it. Go to my hand. She gets it, it stops. So I'm like, what? Okay. As a nurse, what does that tell you? That I am dehydrated. That the blood is not moving through because I don't have enough liquid in it to move it through the fucking tube, bro. Obviously, again, I need a butterfly needle, so I don't have a choice. So I tell this lady, I'm like, I'm dehydrated. So she's like, I'm going to send somebody else in. We'll try that. She tries my arm. Nothing. So I tell her, I'm like, you know what? I'm just going to refuse. And if the doctor doesn't want to release me, I will just literally stay here. I don't give a shit. I will stay here. I don't want to be stuck anymore. This is stressing me out. Whatever. So she's like, I'll get you some Gatorade. So she gets me, first of all, I can't have Gatorade because it has dye in it, but I fucking drink it anyway. So that probably didn't help my fucking asthma attack, honestly. But I was parched. So I had a whole glass of water. Then I had 2 glasses of Gatorade. So I'm like 36 ounces of fluid in. I can't even pee. I'm like, holy shit, I'm dehydrated. But I went to the beach earlier and I had forgotten about that. And then when I got home that night, like I felt really thirsty. So I actually drank like tea that I usually don't drink that night because I was so thirsty. So I was severely dehydrated. So it honestly ended up working out that I went to the hospital because I got a saline bag of, NA, normal saline stuff that, hydrated me. So, because I went into an asthma attack. So, I sit there for a while and I'm like, okay, come on, try again. We'll try it one more time. If you can't get it in my hand, I'm done. Can't get it in my hand. And they were like, at this point, kind of like I could overhear what they were saying. They're like, this girl's so sweet. She's so nice. She shouldn't be here. Like all this stuff. But they're talking about like how my heart's sick and all this stuff and how like all 3 of them tried and they were talking about like my veins and all this stuff. And so the last girl, she was so nice, but she also was like so annoyed at me. She's like, because like I was being a big baby about it. I was like, ouch, ouch, ouch. This is hurting me. Like, please stop. Like, I just do not want to deal with this right now. Getting my blood drawn, IVs is my least favorite thing in the entire world besides like getting my teeth drilled. It's like I can't fucking stand it. The last 2 emergencies that I've had, I have specifically asked for oral steroids because I do not want to get an IV. Also, there's just like risks that you run when you start sticking and stuff. You run infection risks, you run infiltration risks, you run all these risks when you start fucking with people's veins. So I'm like, listen, I don't have health insurance right now. I would not like to get an infection because you guys can't get my veins. And I'm telling you, and I'm advocating to you for myself multiple times, and I'm dehydrated. You can assess that with your nursing knowledge, and yet you are still trying to fucking poke me and do all this shit. And so they're like, okay, we give up. Like, we'll just talk to the doctor about it, basically. So they have to transfer me now to the psych ward. So now I'm out of holding because that's what they do. They collect the specimens there. Then they get you out of holding and they go to a different part of the hospital where the psych ward is. And so that's where I go. I go to the psych ward. And right before I went to the psych ward, I asked the girl on the phone, I was like, can I please get some prednisone? Because I can feel that I'm going to start to have an asthma attack. And when I'm at home, when I start to feel this, I have to take prednisone immediately. I also explained that I've had 2 prior hospitalizations in the last 2 weeks for asthma attacks. So I know when they're coming on. And they could tell that I could not start to talk while I was breathing. But my SpO2 again was reading high, so they were like not really being fast about it. And so I've realized that like so many medical professionals rely on numerical data instead of objective data in front of their face, because it's like, okay, yes, if my SpO2 is high, that's actually not a good indication how well I am doing in a respiratory way, because if you cannot speak while you're breathing, you are obviously in respiratory distress. I'm a nurse. I know these that's why it's so annoying being a fucking patient. Anyway, so, they like get me to the other wing, okay? And I'm like sitting there and I can like start to feel it get worse. So I hit the call button because nobody had come to see me. Because I like really tried to wait. I was like, maybe the nurse will come, and then when the nurse comes, I can kind of explain to her what's going on. Because, they said they couldn't get me prednisone in the other wing, and then I heard the lady give report to this nurse that I couldn't breathe well. So I knew the nurse knew. So I'm like, well, as an oncoming nurse, if I have a patient coming into my facility, because I worked at a nursing home, and the report is that they're having respiratory distress or having a hard time breathing, I need to go assess that patient immediately. That is the ABCs, airway, breathing, circulation. If any of those are compromised, that needs immediate assessment. So I'm like, these are like incompetent fucking nurses because they're burnt out. It's burnt out. And also I realize that they're so defensive because they deal with so many people who lied to them. Part 5.